Good afternoon. This is Sarah with the Department of Medicaid. It's not quite 1 o'clock and the waiting room is still clearing out. We'll give it a few moments before we get started. Good afternoon. It is 1 o'clock. I believe I saw Jordan and Wanda log in. Did I miss any other TAC members as they were logging in?
Real quick, I still have a patient here that I'm still
Oh,
seeing, but I'll be fully joined shortly.
yes, the waiting room's still clearing out. So far it's just you and Wanda that I've seen, so we'll give it a few minutes. Katrina did email. She is going to be late, so you take your time. Our waiting room is clear. I still currently only have 2 TAC members logged in. We can give it just a moment longer if you would like, or we can begin. That's up to the tax preference.
We go ahead then.
I'm sorry, I didn't hear you.
Are we ready to proceed then?
We can if you'd like. The waiting room is clear.
Okay,
Katrina did email me and let me know she's going to be on around 1:30. She's going to be a little late.
okay. Let's give 2 more minutes and then we'll start. Okay, out of respect for everyone's time, we will start. Good afternoon, everyone. I'm Dr. Wanda Figueroa, and I'm the chair of the Disparity and Equity TAC. Jordan and I will be sharing this responsibility, and we hope that that we are able to engage the members with their discussion and their participation. So thank you for joining us today. So as of now, we have only 2 of the members, I will say. Erin, is that correct? Am I missing any other members? Katrina will join us later. Patricia reached out and she's not available to join today. The other members I did send reminders, and so hopefully they will join us later on. Since we do not have quorum at this time, I will not go into reviewing the previous meeting minutes. And also the discussion for the calendar and attendance report. I prefer to do that when we have a quorum or we have other members present. I'm going to be looking at whether this is a good time for everyone to meet, and also the date. I understand that we want to meet right before the Medicaid attack meet, so we can provide recommendations from this group. So in our agenda, we have the presentation and about value-added benefits. And so we have the MCOs present today. And also we're going to be presenting, we'll have a presentation on home and community-based services. I don't know if Sheila has joined us. Before that presentation, Sheila, do you want to say a few words about the input that you are requesting us to provide? Do we have someone from DMS presenting? I'm switching the agenda a little bit so we can allow.
I don't see Dr. Schuster on, and it is under new business. Typically under new business, you'll make the request for the presentation to be presented in the next meeting. But I'm sure Leslie Hoffman is on and can give an overview of the waiver services.
This is Leslie. Can you hear me?
Yes.
Got a little bit of delay. I'm sorry. Can you,
Okay.
Aaron, can you blow up which specific waivers am I talking about or just in general?
In general, I think will be useful
Yeah, I
to
can't.
have that information, and
I
then
cannot see. Oh,
what-
here it is. I'm sorry. I had to change my view option. Please forgive me.
no problem.
Listed as home and community-based services, 1915C waivers.
The C
That's what's
waivers.
listed on the
Okay.
agenda.
Okay. So if, for folks that are was it just a complete overview? I'm sorry, home and community based. I'm just double checking. So, and I don't know how much you wanted to know specifically, but we can also send you a presentation as well. We currently have 6 1915C waivers here in Kentucky. They are designated by specific populations that they cover. For example, acquired brain injury, or elderly and or disabled, those kinds of things. So they are all designated by specific populations. So there is an eligibility criteria. The eligibility would be that you're Medicaid eligible first, and then you can meet the eligibility criteria within the 6 1915C waivers, if that makes sense. We are currently doing negotiation with CMS on a 1915I that will include SMI, SU, and some SUD pieces around homelessness and housing. So we don't have that one approved yet. We are currently in negotiations with CMS and completing responses back and forth to them, if that helps. I'm trying to think, we are currently right now developing a plan for slot allocation of the ones that we received for this time through House Bill 6. And there are several of those waivers that currently have waiting list right now. So that's why we're trying to be very diligent in our plan to release the slots that were approved, as well as not to bottleneck the system. We've done that before, and we don't want to do that. We need to roll them out over a couple of month period of time. And I should have the plan for that within the next couple of days. Does that answer questions, or we can also, for new business, actually provide a presentation. We have a waiver 101 presentation.
So are you saying that you're willing to present that today? You're available to present that today?
If not me, one of the staff from the long-term services area, but I know for sure that we have one presentation that you might be interested in that has things like the 6 1915Cs, our PACE program, and Money Follows the Person, I believe, is in one of those PowerPoints that we just recently received approval for. If you want me to go ahead and send it out though, Aaron, I could, and then we could come back and then we could do a presentation. That way, if they have any questions, they could ask. Does that make sense?
Yes, we can do that.
Yes, ma'am.
Sheila Schuster, Dr. Schuster, she reached out to me and to this committee. And number one, information is power. Obviously, it will help to have a presentation about what the services that are available and how to apply. And so everyone has a good foundation of what the waivers entails. And at the same time, Dr. Schuster wanted to get some recommendations from this forum about how to increase the information to the public, and how can we get the message out so we increase applications and we increase access to services.
Absolutely. Access to communication and really it's about communication and getting the word out there, right?
Yes.
Access and communication.
So, do you have any ideas, and this is for everyone in the group, of how we can disseminate the information that will be presented? Because regardless of the content, number one, we can all assume that this is going to help many families across the Commonwealth. Right. And that it is a great opportunity to access services. So the challenge is that the good intentions are there. The department have been working diligently in making sure that services are expanded. But now the question is, okay, now we have it here, and they're continuing working in that particular area. How can we effectively communicate this to the public?
Right. And currently, right now, with any of the waivers, any changes to the waivers, any updates to the waivers, any approvals from CMS, any changes from CMS, of course, Erin also assists with this. We put everything on our web pages, and Erin, we could probably, when we do the presentation, we could also give them the links maybe to all the waivers online, any letters that are sent out, provider letters, all those kinds of things we send out to. We have provider servers that we send out on a regular basis, and we do updates. Usually you'll see something come out once or twice a week. Now, are you on the server? Don't know about that. And our members probably not. I know with racial health equity, racial and health equity in general, we've been trying to figure out how to reach more populations, other ways that we can reach and get the providers also to assist with outreach as well as to those folks that maybe are less likely to seek services or don't have access and things like that. So we are working on additional strategies there. I was just trying to think, we can probably talk to our contractor as well that helps with that in an effort maybe to assist with getting the word out a little bit better. On some other initiatives, we've looked at, not just sending it out on servers and things like that, and not just having it on web-based, but maybe, like getting into the local areas, churches, barber shops. We've looked into, there's actually a group here in Kentucky that does, they call something related to barber shops, and they can help you get things out into your community. So we have looked at several other initiatives, and we continue to look forward actually to your recommendations as well, right?
Right. Okay. Do we have any additional?
I'm sorry, if you're used to talking about the waivers, and I know this is probably new to a lot of folks on the call today, then we update regularly. We are on all MACs and TAC. There's 16 TACs. We give reports on multiple TACs. We give reports on in the MAC. We give there is a DD council. There's a House Bill 144. These are all meetings that they hold that talks about waivers. They're public.
Yes.
We also on Consumer Rights TAC talk about things. Thrive Advocate monthly group. So it's not that the word's not getting out there, but it's not getting out there probably to some groups that we need to try to get to, right?
What groups do you have in mind? What groups you're having a difficult time reaching out to?
So I hear that folks aren't aware of what the waivers are. These waivers are old. They've been in existence, some of them since the Model Waiver 2 actually started in 1987, and the HCBS waiver I think was even earlier than that. So these waivers have been around for an extremely long time. Most of them, there's several of them that are filled to capacity, and we have a waiting list. So that's what we're trying to work on, the waiting list now. So when folks say that they haven't heard about the waivers, it's got to be folks that don't have access to regular conversations, online engagements, are not attending the public meetings. Just, you know what I'm saying? So it's folks that aren't used to accessing services, I would think.
Okay.
And it's not like with any Medicaid program eligibility and all those pieces, that's, there's always a process there, documents that are required, those kinds of things. So they all would have an identified case manager. And we've developed a system called the Medicaid Waiver Management Application System. I'm trying to think of it, if the A is application. And that houses a lot of the information that case managers can go in. And if somebody's not eligible for one waiver, but that, or if they are eligible, but there's a waiting list, it will automatically let them know about other opportunities. They can also receive state plan services. You're familiar with that, if they're not in a waiver.
Okay.
As long as you have Medicaid, you can receive state plan services. Waivers are a little bit different. You have to meet specific criteria for the population that waiver covers. And CMS guides all that. It's not a CMS guides that.
Okay.
It's an alternative to institutional level of care. So that means you have to meet that criteria. You are at risk of being in an institution.
I want to share some of the things that we're doing at River Valley and that it has helped, but we want to expand our outreach to communities that sometimes have a hard time getting the information. So we met with the superintendent of the school superintendent, and during their parent and student open house, we will have a booth and the case managers will be there disseminating information on what the waivers and other services as well. And this year, in 2 weeks, we're going to have the first annual Latino health fair. And so we are planning to feature this information prominently because that's a population that have the hard time accessing information. And so we're using our back to school sponsorships and back to schools events to disseminate information about behavioral health services, but we're focusing on the waiver as well, since this is something that could be life-changing. And again, it's an ongoing process. As you mentioned, the waivers have been in a system for quite some time, but it is important that we continue providing this information and looking for ways to enhance what we are doing. But now that schools are going to be starting in a month or month and a half from now, is an opportunity to reintroduce to students and also to educators, schools, and parents the services that are available. One question that I have is about the social media campaign. What are we doing in regards to using platforms like Facebook, Twitter? Maybe Facebook is too old right now. One of the Instagram or stuff like that, or other social media platforms to
So
get the message out.
Wanda, I would like to, sorry, Dr. Figueroa, I would like to
No,
let
it's
you know
okay.
that
Wanda, it's okay.
we've actually got a really, this has not been forever. This has just been in the last 2-3 years. We have a robust social media now that Beth Fisher runs. So we are on all social media right now. I don't think we're on Snapchat or anything like that, but we're on, like, Facebook, Instagram, Twitter, and she does a fabulous job at sending that out. We also send a lot of that information out in newsletters, but that has just started in the last a couple of years that I've been back. So, and I have to give
Okay.
Beth all the credit for that.
Okay.
But yes, do we need to improve communication out to folks that maybe haven't had access to that information? Sure. And it's not just the waivers, we're working on that across the board in Medicaid, because I've done that as far as trying to get MCOs and providers, which they've been willing to work with us, to look through the lens of racial and health equity, and to help us to figure out ways to incorporate communities. So yes, I'd love to hear your thoughts too. So sounds like you've got some good ideas going on there in River Valley as well.
Okay. Do we have any ideas from the participants on this call?
I would like to note for the record that Patricia and Katrina have both joined us for TAC
Fantastic.
members, and Sheila Schuster has also joined us.
Okay, great. Thank you. Any recommendations from the floor? Sheila, you want to say a few things, Dr. Schuster?
Yes, thank you so much for giving me a couple of minutes. I'm Sheila
Yes.
Schuster. I'm a licensed psychologist, and I'm the longtime chair of the behavioral health TAC, and more recently am the chair of the MAC, the Medicaid Advisory Council. So this issue came up at the MAC. It actually came directly to me from Commissioner Lisa Lee when she was approached by several parents, and these were parents of children who were medically fragile or had significant disabilities, and they were concerned that it had taken them so long to figure out that they were possibly eligible for Medicaid, and then to find out what waiver services might be available. And that's what started this whole kind of ball rolling down the hill here. So I reached out to probably 5 of the various TACs, and the Disparity Equity TAC was one of those. Really with some documents that Pam Smith, when she was at Medicaid, had provided to me with some materials that were available on the Medicaid website. And there probably are many things that we could do in terms of the written materials that are available to people. But I actually think, Wanda, that the discussion that you were having, the examples you were giving from River Valley, are really where I think maybe this TAC might have some better recommendations for us. And that is, you know, where do we meet people who may not think that they're eligible for Medicaid? And in this case, it was children were eligible. The parents probably were not. And they were eligible because of the level of their disability. But what I'm hearing, and I've talked to several of these parents that also had reached out to Commissioner Lee, and basically it was a trial and error process on their part. And they got most of their information by finding other parents that had been down that road ahead of them, if you will, and had given them the information. So I think we have lots of information on the website, and we could take a look at those documents and probably get them translated not only in Spanish and possibly other languages, but to make them more easily readable and understandable. But I think the bigger question is, we still have a lot of Kentuckians who don't have access to internet or even social media. Where do we meet people? And what you're suggesting, Wanda, is doing the face-to-face
Yes.
your open house at school, through your Latino health fair. Some of the suggestions we've had from some of the other TACs is making more, at least materials available and given in their hands by the providers themselves. I don't know how much providers are doing that or thinking about that. So if you've got a pediatrician who's seeing a youngster who may be newly diagnosed with a developmental intellectual disability, is that provider thinking about available resources? And are they thinking about Medicaid eligibility and waiver eligibility? And I'm not sure we've educated the provider community, or maybe people in the provider offices. The other suggestion that we had, you know, we have connectors who have been wonderful folks out there to get people enrolled in Medicaid. But I'm hearing from the connectors themselves that they have very little training in the waivers. That's a piece that's probably been missing as we've gone forward, because the connectors actually end up being kind of ongoing resources for people when they run into an issue or have a question.
Yeah.
I'm wondering how many folks are familiar with the community health workers, the CHWs, that we passed legislation 2 sessions ago to make them eligible for reimbursement by Medicaid. And many of them are trained in various health issues and so forth. But those are just some of the ideas that have come across. So I would be very interested in hearing from your TAC members, Wanda, if there are other thoughts, because you all represent hard to reach, if you will, overlooked or underrepresented populations. And those are the ones that we need to think not only about perhaps people that economically might be underrepresented, but people who are not even aware that these services could be available, particularly for their children. That's what really got this started. But I think in general. So that's why the request went out to you all. And I've talked to more and more people. I think the input from this TAC would be more helpful around outreach kinds of activities and getting to communities of color and underrepresented communities than in the actual materials themselves. So I'll stop talking at this point. I'm happy to answer any questions, but that's kind of where we are in this process, and it's an ongoing process, obviously.
Anytime that we have a hard time getting information out, we reach out to schools because they have a captive audience
Right.
and work with them because this is something that will benefit them as well. Also with the faith-based community, getting that information out, whether we have a breakfast with faith leaders and talk to them about the services that could potentially be available to them. And but third one that I'm thinking as you were speaking were about doing an ad, a 30-second or 1-minute ad for TV or radio. This is
Excellent,
particularly
yeah.
important in the farming community, rural and extremely rural areas, that there is a preponderance of using radio as a
Radio,
while
yeah.
they work, and that could be we have used that in the past for the suicide prevention and for the 988, and it was one of the best things that we have done in getting the message out for the rural community, the rural counties that we serve. So I wonder if that could be a possibility that the department can develop work with a company to develop a 30-second or 1-minute. And the and for the radio, for example, they're quite inexpensive. I was surprised how inexpensive it is, but so we're using it quite a lot. And we have not developed something for the waiver, but I'll be interested in doing something and sharing it with you and see how that works.
Yes, I'm glad you brought that up because we did have the suggestion about TV and radio, and I know TV is much more expensive, although sometimes the local cable companies, and I guess the question for Medicaid, and I'll ask Leslie to take this up the line, could some of these qualify as PSAs? Or public service announcements? I don't know how that works exactly.
Yeah, I'm sure like, as far as like newspapers and things like that go, we have to pay for all those ads. And so maybe it could be, we just have to, get approval all the way up the chain for something like that. But I am concerned, Dr. Schuster, you're aware that we have significant waiting list right now. So when you put something out there that's not available today because we don't have slots, that just concerns me that there may be, some right off the bat be some miscommunication or some not understanding. Does that make sense?
Yes.
Yeah, it does. And even though we got more funding from the General Assembly than we've ever gotten, they actually funded 1,925 new placements across those 4 waivers. So that's significant. But yes, it's not going to make a dent in those waiting lists.
No, it will not. And so we're telling people to apply and doing a public announcement that there might not be an option today or tomorrow. So I just wanted to let you know that we are working on a plan to use those House Bill 6 allocations. So I should have that done in a couple of days. My main concern before you got on, Dr. Schuster, is that we don't send those out and we bottleneck ourselves. I have to take in consideration what the providers can do without that bottleneck scenario. Because when that happens, nobody gets an assessment. So we have to make sure that they flow through. I'm trying to look at a partnership with DBH and Medicaid right now. We're looking, and Dale, we're trying to look at the slot allocation, if we could roll that out maybe in 3 months. You are aware of this as well. Even if I allocate 250 slots, a high percentage don't take it. It rotates around back to the next month. Even if I do a 3-month process, it would probably be 6 months before we get through those. Does that make sense? It's just the nature of the beast, and it always has been. So, but we should have a plan just within a couple of days.
Yeah, it's a good problem to have because we've got slots.
Absolutely.
And get people assessed and move them along. I guess the other thing that I'm thinking, because the initial request for help came from families of very young children, is an exciting thing on the horizon is the development of a children's waiver that would serve kids with autism spectrum disorder, severe emotional disturbance, and then that chronic combination of physical and intellectual developmental conditions. And so if part of what we're trying to do is to make sure that those families, and it may be frustrating, but it may also be hopeful that they get on a waiting list for a waiver that could be developed in the next couple of years and put into place, because our children are kind of looking around for a place to land. And we all know that the sooner we can get those services to them, the more optimistic we can be about their outcomes and so forth.
Mhm.
Dr. Schuster, we're looking at some other options that could be like researching for what could be included into that child waiver. So I just wanted to let you know that we're more to come, especially with the work groups that we had held before. We do have your recommendations that came out of the feasibility study recommendations. Right. I do have those in hand and shared those with Commissioner Lee yesterday. So I just wanted to remind her that while we're looking at other options that we might be able to include into a child's waiver and or state plan, it might be a state plan amendment, kind of like we've not made that final decision, but I just wanted to let you know we do have your recommendations. So I shared that with them.
Yeah, thank you. So yes, there is that. We were talking about that on the 988 call. It's a wonderful thing that we have the 988 number out there, and we want to market it, but we also want to be sure that we have the workforce available. And you're aware of this, Wanda, in the community mental health centers to answer an increase in calls coming in. So it's a kind of two-edged sword, but I still think that basically, we want to let Kentuckians, all Kentuckians, know what their Medicaid program has available, whether they're eligible for waivers or not. So that's the kind of overall picture here.
Do we have any statistics about those who are participating in the program? How many of them are coming, let's say, from rural communities versus urban? Because if it's a matter of, we know that there are limited slots, but that some communities are underrepresented in those that are applying and getting the waiver. Maybe we can focus on those kind of to build equity, which is the purpose of this
Of the TAC,
this TAC, right?
Yeah, currently right now with the waivers, it's first come, first serve. However, the SCL waiver has 3 components: an emergency, an urgent, and a futures planning. So there's different criteria to meet those. One's like immediate, one's like within a year you're going to need a waiver, and one is like can be an extended amount of time. And a lot of times the folks that are on the waiting list are already receiving services in another waiver, but they're not in the waiver they want to be. For example, maybe somebody's in the HCBS waiver that's got a smaller package of services and they want to get to another waiver. So they're in one waiver and on a waiting list for 1 or 2 other waivers. So that's something we're looking at. We're addressing the waiver and waiting list. Dr. Schuster, you're aware that there's a piece in House Bill 6 in the free session that talks about us addressing the waiting list before the slots that are allocated in 26. We have to do a report out, and I think that's in October. So we'll probably try to have the report completed like August to get it to them before approved and through the processes through October.
Wanda, I don't know that there's any mechanism, and I don't know whether we want there to be or not. Leslie obviously is correct that those slots are awarded on a first come, first served. In other words, those who have been the longest on the waiting list get the next open slot, regardless, of where they are coming from in terms of where they live, urban or rural. It still might be helpful to or to even make some assumptions. Probably our rural communities are not as familiar with
Right.
Medicaid and the waivers.
And I think I understand kind of where you're going with that. The only thing right now that CMS will allow us to quote earmark is the money follows the person slots that we have, and that's been done through an application process and CMS approval. But I kind of hear where you're going with that. Would we even look at trying to meet the needs of the rural area? I'm hearing what you're saying, or the folks on the waiting list, where is their demographics, right? Like where, if we can get an idea. For the most part, what I see, and I'm just being honest, the new folks that are coming on for most of the time, especially with person directed services, or what we used to call CDO, it seems like the largest amount goes towards the Louisville area. So I'm just going to share that with you. But I'm not saying that I don't know if that accurately represents the people we're not already reaching. Does that make sense? These are the people that already know to get on a waiting list, or that they can be on multiple waiting lists. So I don't think it's going to accurately reflect what you're looking for, but we can think about that. I don't mind to think about that. Like maybe we can make some recommendations. This group can help us drive some recommendations. Dr. Schuster often does that in the behavioral health TAC.
Yeah, it's interesting because if you listen to what the parents have been telling us, it's that word of mouth. And so you're more likely in a community like Louisville that has a large number of waiver participants, or at least waiver waiting list people, and probably has more advocacy organizations set up in Louisville. I'm thinking of the Council on Developmental and Intellectual Disabilities that's housed in Louisville. Some of those agencies are probably more active. And I guess, Wanda, that's the other thing that we wondered about. Obviously, the community mental health centers are across all counties and have this information, but are there other entities that have contact with people? I don't know, even your, food services, housing providers, those kinds of sister organizations, I think is what they calls them within the cabinet, but they really are. It's the other agencies that are dealing with social determinants of health, basically. And do
like
they
the primary
information? The
primary health department, pediatricians, and all that.
The Office for Children with Special Health Care Needs also houses our state family-to-family representatives. And that's what they do, so I do wonder if the counties or the communities that have Office of Special Health Care Needs office, wonder if they have more kids, are connecting more kids to services for waivers.
Yeah, I think it's a good question, Dr. Terrio. The ad districts themselves, and are they providing that information? They house the area agencies on aging, and we know that there are elders, if you will, who are probably eligible for services under the home and community-based waiver that may not even be aware of those services. So at the other end of the age spectrum, I guess, are the people that have an aging family member or have those aging services aware of some of the waiver services that might be available.
Dr. Schuster, based on what I said to you earlier, the fastest growing, of course, is that those assessments where folks are looking for mostly the Michelle P. waiver. That's the one that's growing the fastest and has been for some time. Our three top just community mental health centers, I was having to look, is 7 counties, North Key and New Vista. So I don't think, like I said, the waiting list is going to get you the information about the folks that are not knowing about the waiver. Because that's the 3 areas that are, the larger areas.
Yeah, those larger urban areas.
Dr. Figueroa and Dr. Schuster, this is Stuart Owen with WellCare. I just want to throw in real quick, and I suspect we're not the only MCO, but WellCare, when we identify a member, it's typically through case management. that we think is eligible for one of the waiver programs, we try to connect them and link them, but I know we keep running into the challenge of the waiting list, but I suspect, the other MCOs do as well. So just an FYI, we try to get the word out.
Yes, right. Yeah, thank you, Stuart. And I'll
Sure.
add that.
Thank you.
Well, that is,
And
you have contact though with people that are already into Medicaid. And some of these initial questions, Stuart, came from people that were not in Medicaid.
Right. We would only be dealing with people
Yeah,
already.
you would be dealing
Yeah.
with people that are already on Medicaid. Thank you.
Dr. Schuster, this is Dr. Batista with La Casita Center in Louisville.
Yes,
Regarding communication and particularly thinking about those who haven't been reached because of language or mainly language, and you were talking about radio and TV. I think, thinking particularly in the Spanish-speaking population, radio is the best thing. And I would say, just like Ms. Huffman was saying, the better utilizing or continue utilizing social media platforms, because it's through Facebook that families from Africa and Arabic-speaking families and even Spanish-speaking families will get connected. It's still very used, and radio, particularly for Spanish-speaking families, have worked very well in Louisville. And I know that, for example, a group of immunization advocacy is working on radio spots for the rural community. So I would advocate definitely continue using social media and Facebook in particular, and then radio.
and the
TV,
radio. Yeah,
that is not a good idea because many of the people will be watching just
Correct.
they have cable TV in their own language, and if not, it's hard for them to watch TV in English. So radio would be a better
Correct.
investment.
Mhm.
thank
Mhm.
you so much, Dr. Batista. I appreciate that.
Yes, I agree.
And there's
Any other
something in the
recommendation?
chat
I'm
here
sorry.
from retired volunteer programs for aging.
Any other recommendations?
On
Priscilla, yes?
I just had one question.
Yes.
Whenever, and it won't necessarily add people who would be eligible for waivers that aren't already applying, but when people are initially applying for Medicaid or they're doing their renewal, is there any type of screening that would look for if they would be eligible for waivers when they're initially applying, or do they have to try to apply for the waiver specifically in order to be like screened for that?
That's a great question. Is Leslie still on? My layperson's response to that is that I don't think that there's any initial screening, and that's where the connectors come in. Those connectors take that original application to get the person onto Medicaid. They're the outreach people. And I think those are the people that we're looking at that we think need to have much more training on the waivers and the eligibility there.
Yeah. I just didn't know if there would be some type of screening question, like, do you fit within any of these criteria, whether it's intellectual disability or, any of the other categories that they'd fall into that would initially just trigger someone to look into what waiver they may fit into and see if they're eligible for those services at the very start, rather than them having to pursue it themselves.
Mhm.
Yeah, it's an excellent question. We can go back to Leslie if she is not able to stay on. And I don't know the answer to it.
I'm on.
Chris-
I'll have to drop off soon. Dr. Schuster, I'm sorry, I just walked away for a minute.
Yeah. So the question is there anything in the application, the basic application to Medicaid, that might give a clue as to, or could be added, see if there's possibly a waiver need there?
So I'll need to check. I know there is something there because there's a code that the beginning eligibility criteria screen in the system. It's like the first page of the screen does list like what eligibility like, I know this doesn't mean a whole lot to you all, but it's like For example, J is like ABI long-term care, K is like ABI acute, something like that. So I know there's a place to identify that. Are the screeners doing that? Wholeheartedly, don't know. Are they doing it to full fidelity? Don't know that. But we can definitely discuss that, and that's something that we can put on. I think Danita's on here too. We can put that on our radar to take a look at with our group, because I may be misspeaking. There might be something there that I'm just not remembering. But
Yeah,
as
that would
far
be
as the Medicaid
helpful.
waiver application portal that we have, if you put your information in, and anybody can make that recommendation, right? It will let you know that, hey, you meet brain injury, the brain injury waiver, there might be a waiting list right now. So we have also sent you down to the HCBS waiver, and maybe you qualify there. So it does know to do those things. And Money Falls, the person, is now in that system as well. And we're looking at other modifications for that system.
So if you know to get to the waiver application process, is that right, Leslie?
Yes,
Then
that's
get
it.
some direction,
Mhm.
but you have
Yep.
to, people have to know to go there.
That's
And
correct.
that's
And a
why
case
I think
manager,
that-
anybody can help with that, right? Anybody
Yeah.
can get that original referral to us. And of course, I know folks don't like to talk on the phone, but folks can call and talk to one of our representatives. We've got a call center that Ricky May handles. He's also over the SCL Michelle P waiver. So I'm just saying we've got other options. We can get, Aaron can help with this too. When we do the PowerPoint presentation, we could also grab some things off of the our web-based portal to give out to folks as well.
Okay. Priscilla, I see a comment that I think that is worth exploring. Could you elaborate on that?
Yes, so I am a connector for Kentucky Voices for Health, and we hear questions often, not only from consumers who are trying to find or trying to figure out how to apply for waiver services, but also from other connectors who don't know much about waivers whatsoever. They don't know the six different types. They don't know how any of those work, and they don't know the application process themselves. There are some screener questions on the application, but it's not fully explained that those are screener questions for waivers. And I think even that specific call out would be really helpful so that folks know exactly what they're applying for. The way that the application looks, it looks like you're just applying for regular Medicaid. And there are those additional questions, which some connectors, which sometimes can look like you're being evaluated for just other categories of Medicaid, like maybe not Magi Medicaid, but any of the other categories. And so just some more specific training, some more specific explanations, more specific call outs that like, this is a trigger question for applying for a waiver would really help make that process much clearer, both for connectors who are helping consumers, but also for consumers who are applying on their own.
That's super helpful, Priscilla. And I think it goes back to the question of, even if the screener questions are on there, if the person who's helping with the application doesn't realize that that's what it is, then it probably dead ends at that point.
Yes. Katrina, you have a recommendation about outreach that is worth exploring. Could you elaborate?
Yeah, sure. Yeah, there's several programs specifically geared towards seniors that may not necessarily be receiving already on Medicaid. And I just mentioned one, retired senior volunteer program. There's several programs like that. You know, if we could just get the information out to them, it could be shared. That I think would be maybe another population that we're not hitting as often.
That's
great.
called the RSV program, is it, Katrina?
Yes, RSVP.
Yeah.
Yes. Mhm.
Yeah, thank you. That's a great idea.
All right. Okay. Any other ideas? Go ahead.
You know, listening to what Priscilla just proposed, the training for the connectors just goes hand in hand with what Dr. Burke proposed, and it just pops in my mind, maybe creating a shortcut, you know, between those positive answers that would fit into a waiver and then taking that person into the waiver application, or at least to create some kind of note, the special notes for connectors that are filling up the registration. But sometimes there, there's people that would be adventurous enough to do it by themselves. So even if we don't have a connector doing this, maybe a pop-up note or advice, this is a shortcut for a waiver application, so keep this in mind. So kind of highlighting those questions that Dr. Burke was talking about, identifying what, if you respond positive to this, will make you a candidate for a waiver, and then in consequence would take you straight into the next registration. It's just
Yeah.
Like a decision tree, a pathway. Okay.
I would
Yeah,
like,
so that the information doesn't get lost, I think is really, what we want to do. Somebody's answered in a way and it's gotten missed. We don't want that to happen. I guess I would ask Wanda whether this TAC might want to consider making a recommendation to the MAC that connectors be specifically trained about the waivers.
Yes.
Just a suggestion.
this is Brooke from WellCare of Kentucky. I manage our pediatric and NICU, initiatives in their Medicaid line of business. And something that we run into quite a bit is our facility partners. So the University of Kentucky Children's Hospital, Norton, Cincinnati, other area hospitals that have a really robust care management and discharge planning team. They lack a little bit of knowledge about our waiver programs and their functionality in the state. So one topic that typically comes up are the Model 2 waiver questions related to whether or not they can receive private duty nursing while they have Model 2 waiver. And so we have a lot of our population declining waiver services out of miscommunication, misunderstanding, or lack of us really having the same messaging from even the facility standpoint. So the potential there and an opportunity to enhance the knowledge base of our facility partners that are managing a lot of these kids that would qualify for waiver might be another area that we could look into as we try to close this disparity among just, our general state's knowledge and our population.
That's a great suggestion. Thank you so much. I hadn't thought about the facilities, and I guess I assume that they know all that information, and obviously we should not be making those assumptions.
Yeah, we find
that
we send out your all's website. I do want to send a compliment out on that. It is really grown in your waiver information that's been on there the last year or so. We appreciate that. We can also share some of the, public communication back and forth to try to educate them from our lens as well. Of course, and that would apply to any MCO and Medicaid member, but just thank you for getting that, more clear and available to the public. I think they have benefited from that significantly, but there's still some work we could probably do there.
Yeah, thank you.
All right, thank you. Well, it seems that we have a couple of recommendations to share with the MAC committee. Thank you so much for your comments and recommendations. Dr. Schuster, do you have any other questions?
No, I just want to thank you all. This has been just very rich and very, very helpful information. And as the MAC takes these recommendations, and I'm in touch directly with Commissioner Lee, because she really wants to make this a priority. So you all have been immensely, immensely helpful, and I appreciate it. I'm going to put in the chat, or I can just tell you my email address, and if somebody has another thought, because sometimes it doesn't come up when you're in the meeting, shoot me an email and I'm happy to take those. But I appreciate so much having the time to talk with you all.
Thank you so much, and thank you for all you do, which is a lot. You're a personal hero of mine.
Well, thank you.
Amazing. All right. Okay, let's go back to then the presentations and value added benefits. I was going to go with alphabetical order, but my first name is Wanda and I was always the last. So in a gesture of empathy, I'm going to flip it. I'm going to start with WellCare. Can WellCare present? I'm going to start with the doggies now.
Dr. Figueroa, this is Stuart on with WellCare. I was ready for the switch.
All right.
Yeah, I thought that could happen. Now I'm slow to care. That's my problem.
Right? Yeah, I empathize.
Can you see?
Yes.
All right. And I'm sorry, I've got the little small mini slides on the left. So this is from 2023, last year, calendar year 2023. And we've got, the utilization, which means that it was essentially claimed, the given value added benefit was claimed. And then to the left, kind of have some highlights about it. And so no surprise, the most claimed benefit is the over-the-counter catalog. We have a catalog of literally hundreds of items that you can get at a pharmacy. Any type of pharmacy. And so you can see like over on the left, we have it, there's a cap per person, like $10 a month if you're single, $20 a month, and this is per household as well. $20 a month for 2 people in a household, and then the cap is $25 for 3 or more people in a household. So you got that budgeted amount essentially, and literally, like I say, there's hundreds of items there: allergy medicine, arthritis medicine, diapers, a lot of baby products, dental, oral care, eye care, first aid, diabetic socks, smoking cessation, cold, flu. I mean, there's literally hundreds of items, even detergent you can get in that. So it's no surprise that's number one. You can see back over on the right, 143,000 plus. And so, and then the second thing, might find a little bit interesting. So it's adult vision exams and adult eyeglasses and contact lenses. So as background, last year, and we say bravo to the DMS, they expanded the coverage of vision benefits as well as dental and hearing. It was effective 1/1/23 to adults. And so historically, it was pretty much under 21. And so we had covered for several years, we had offered as value added benefit eyeglasses and contact lenses for adults because they couldn't get it through the Medicaid program and the exams. Well, actually, not the exams. It was just the glasses and contact lenses. But there's a limit on everything. And so we kind of debated, it's like, well, we're going to keep it as a value added benefit. Yes, you can get it through Medicaid, but what if you lose your glasses or broken or whatever? We want to keep it out there. And you can see utilization remained extremely high, 42,000 for the vision exams, 36,000 for the glasses and contact lenses. And that's despite the fact that it was covered as a Medicaid benefit. The next item, the SafeLink cell phone, that is actually a federal program that you may know them as Obama phones. It was created from federal regulation when President Obama was president, and it's free. 350 talking minutes, unlimited text, the phone. It's free if you are a Medicaid beneficiary, SSI. There's a veterans program as well, several different programs if you qualify. Yes, SNAP, food, and or you just simply are under 135% of the federal poverty level your income is. And so we did not, this is actually a government program. We did not pay for those 185, but we referred connected people to the phone. So I just thought that would be something to throw out there. We do actually provide a few rows down a cell phone through AT&T that is targeted. It's for members who critically need a phone. And so we offer it for pregnant members and also those who have severe chronic problem, because it's just absolutely critical. They need to be able to talk to their healthcare provider. So that's why we offer that. You can see there's over 1,000 people that utilize that in 2023. Weight Watchers is another one, 1,200. And we actually do something that we launched last year with Weight Watchers. They also have a program called Curbo, which is for adolescents 13 to 17. And so we so some of that is included. It's actually at adolescents 13 to 17. They have to have a body mass index of 85%. So that's, you could see, you know, some nice utilization there. The meals program. So historically we did it. So this is basically, you get 10 home delivered meals after you've been discharged from inpatient hospital, rehab hospital, nursing home. And we added last year behavioral health, because, you know, the thinking was, okay, you're obviously medically fragile state or whatever, you need some meals. Who knows if, you know, if there's anybody going to be available to cook for you. And so we finally realized, well, you know, I mean, if you've just been discharged from, say, a psychiatric hospital or residential substance use or whatever, you know, you're fragile as well. So we added last year that scenario, that discharge from that type of facility as well, to get the 10 home delivered meals. And then down the list, I mean, you see like criminal record expungement, Nike shoes, Amazon Prime. And but the whole point is we're trying to, you know, address needs at different levels. Like I say, you got to start from the newborn, moms, kids. You can see tutoring, but it was not utilized very much last year. 23 12 1-hour tutoring sessions, free, but only 23 children took advantage of it. And then also, you know, it's geared towards adults, helping them to be self-sufficient, basically help them to be able to function independently in the community. So that's kind of the goal. And it is actually possible for one given member to attain up to $4,500 in value-added benefits for a year. So I'll just stop there. That's the presentation. Be glad to welcome any questions if anybody has any.
Are these the numbers that you will expect based on the membership, or do you think that there is a need for more people to access or know about these value-added benefits?
So very good question. We budgeted last year $10 million, and I think the ultimate spend ended up being about $8,500,000. So we've got, you know, it keeps shrinking, but our current membership's around 430,000 members. It keeps shrinking because the eligibility, everybody's having to reprove that they're eligible once a year again for Medicaid. That began, you know, a year ago. But I mean, we had left over, like I say, we budgeted about 10 million and we ended up spending about 8.5 million. So not everybody, I mean, we still had more, you know, basically capacity for people to claim more benefits that were not.
Okay. Thank you. Any questions from the group? Okay. Thank you so much.
Sure.
For the information. United?
Hi, can you hear me? This is Christina Ramos with United Healthcare.
Yes.
Okay, perfect. Let me share my screen. Well, this may not work. Let's see. Okay, can you see my benefits here?
I don't. Not yet.
Oh. Okay, let's check again. Now can you?
Yes.
Okay, perfect. Sorry about that. I'm standing in for Ashley on our team today, so I'll go through some of these quickly. Some have been added, and there's some on here that are not listed yet that we are putting in place for 2024, such as transportation. But a few that we wanted to touch on that we really enjoy are the doulas, offering doulas free of charge to our members. Our pregnant women, and they follow them through the pregnancy as well as after. If they have any questions, concerns, anything pops up, helps get them to the right place, or at least have someone along their journey to help answer any questions, ensure that they schedule their appointments, and are in the best hands as far as having someone there to help them along their journey as well as afterwards with their newborn. We have our diapers for babies where they deliver 200 diapers once the mom completes her 6-week postpartum visit. So that one has been reported out that's one of the valued benefits that our members really appreciate. A few other ones, the Healthy First Steps, the doctor chat, which is just where they have 24/7 access to a physician on call. Our home delivered meals, it's through a vendor called Mom's Meals. Our members receive, this is very similar to what WellCare had said, receives those delivered meals after inpatient stay as long as they meet requirements. But we also added in at case manager's discretion if they feel that it's a member that wouldn't historically qualify, that they meet those parameters, that a case manager can also refer them for this program of the home delivered meals. For our QMAC, which is where we receive feedback from our members, we added in there a $50 stipend for our participants just to demonstrate how much we truly value their feedback and want to continue to make improvements based on what our members are sharing with us. Our healthy rewards, mainly completing those preventative services, and then the free cell phone as well, like WellCare had mentioned. And then On My Way program, assisting our members in getting their GED, any education related services, we help them as well along the way. Here it shows our utilization. It's not a specific breakdown based on membership, but what we thought was interested is the percentages are larger in some of our smaller counties as far as utilization and participation in these benefits versus our larger counties are not utilizing as frequently the value added benefits as we would have anticipated. We're trying to reach our members through their handbook, through our website, member portal, our marketing materials, and then as well with our community health workers or advocates, case managers, any staff that has contact with our members, just to make sure they're educated and informed about our value added benefits. And that is it.
So how much did you allocate for these value added benefits?
That is a fantastic question that I do not have the answer to, but I will ask the individual over member services and I will get back to this group here in just a bit with that answer.
That would be great.
Yeah.
Okay.
I also have a question. WellCare explained to the group that members who left the hospital or mental health hospital as well are eligible for home food delivery. What is the eligibility requirement for home delivery meals for United Healthcare?
I think it is very similar to WellCare that as long as they trigger in the claims that as needing or triggering for potential long-term stay or a service that would be needed as far as individuals that were coming for like SUD or some type of mental health disparity also trigger. So someone really it's a claims is triggered from an inpatient stay and then reviewed by case managers and other individuals to refer the member out.
Do you take into consideration whether they live alone, not just the clinical condition, but the follow-up? I think my question is more in terms of what is the criteria, which goes with what Patricia is asking.
Yeah, so a lot of ours is based upon the diabetic population as well. That's where a huge amount of our referrals come to individuals that could potentially benefit from that. I know this program has expanded as well, and we're currently piloting with 112 meals, not just the 14 home deliver meals. So that particular portion is trigger from our inpatient diabetics that have high A1Cs, high blood pressure, any of those type of results are automatically triggered and qualified, and then they are contacted to see if they would be interested in participating in the program. So the same with our individuals that are from behavioral health as well. So if they come back with a high blood pressure, high A1C level, then those would trigger as well. let me check on the specifics. I'm sorry that I am not the expertise in this. The other individual is out for a family illness, but let me reach out to Ashley and get her intake, and then I will refer back to this group here in just a moment with those answers.
Sounds good. Any other questions? Okay, do we have passport? Do we have any representative from Passport?
Cindy was logged in, but let me
Yes,
see.
ma'am.
Oh, there you are.
I'm
Alright.
here. Yes.
Okay.
It is not allowing me to, oh, there I am. Okay. Let's just do this. I am going to share my screen.
Okay.
Okay. Let's share. Okay. There we go. Sorry about that. Passport has, we had 8,434 unique members access our VABs in 2023. Our top 5 utilized were our health risk assessment, our dental visit, the annual wellness exam for adults, our cervical cancer screening, which is our PAC test, and the well child visit. So, we communicate with our members about our value-added benefits through several ways. We have community events where our CE partners, which are our community engagement teams, they host events, they attend events. We partner with other, sometimes other MCOs. We actually, we've hosted some expungement clinics. We've done, they're getting ready to kick off all our back to school activities. We do member education sessions. Those are held at our one-stops. We currently have 5 one-stop locations where they are staffed and members can come in and ask questions, get assistance with what they need, that type of thing. Our members also can opt into text message and email notifications, and we do have text campaigns and email that can be sent, that it's just a communication method. So we communicate. It's actually our VAVs are actually part of our member handbook, and that's part of our welcome kit that goes out to all the members. It's posted on social media. We do website updates. We do live outreach calls for preventative health. So like mammograms, HRAs, child wellness, those types of things. Those are those type of campaigns that happen. And while we served 8,434 unique members, several of those members, we have members who actually access a lot of benefits. So like a pregnant woman can get her HRA, she can get her wellness exam, she can get her, we have a maternity benefit, we have a postpartum, if they go to their postpartum visit, then the baby starts off with their well child visit. So it's like that. So we have a very robust program. We do offer the free phones that the government does offer, the federal government, and we do offer unlimited data to our members. And while the ACP program, it did not get renewed yet by the federal government, we are continuing to offer that to our members as the free data. It's unlimited, and that's truly, for 2024, we have made an enhancement. I know we're talking about 2023, but in 2024, we have introduced Solutran. Solutran is, our members now have 3 categories that they earn their rewards. They earn rewards by doing the same activities. Go get your HRA. But instead of them picking a gift card to all the approved vendors, We now issue gift card credits. They get one card. It is reloadable. And the member chooses how they want to spend that card. So if I am a mom and let's just say I'm pregnant and I do my pregnancy things. There's I can earn up to $150 in pregnancy rewards. So I can then, there's a pregnancy bucket, a well-being bucket, and a pay at the pump bucket. I decide how I want to spend my rewards. So if I want to save all of my rewards, they don't expire for 18 months. So I can save those. And then if I decide I want to spend everything, I need to spend it all on baby items, then all my rewards I can put in my baby item bucket. If I decide I want to keep my baby items to my baby items and I want everything else to go in my well-being, then I can buy groceries. I can buy groceries, I can buy children's clothes, it's that type of thing. We are empowering our members to truly have control and they have ownership of how they want to spend their rewards that they earned. And this has been, we've had a lot of great feedback on this. The members are excited that they can, decide how they spend their money, and it's making them feel more empowered in their care. Are there any questions?
What percentage of members are utilizing the value-added benefits?
I will go back and get you a percentage. We had the opposite of United. I will tell you that we've had some in our rural counties, but it was more around the region. It was more of where we expected, but we do advertise these in the other counties, but I can get you a percentage compared to membership.
And I think that's an important question for each one of the MCOs that we have, because what we would like to see, not only people getting health coverage and access to services, but benefiting from the value-added benefits. Redundant what I'm saying, but in one way of looking at that is the percentage of utilization and how we can increase that. Any questions or comments? Well, thank you so much for your information. Very helpful.
Thank you.
All right. Humana?
Hi, thank you so much for the opportunity to share. I'm going to share my screen. And if I could get just confirmation when y'all are able to see.
We are.
Great. And you're looking at my slide deck, not the other mess on my other monitor, right?
Okay, you're good.
All right, thank you so much. I'm Leslie Clemens. I am the Director of Equitable Population Health for Humana Healthy Horizons of Kentucky. And so we took your assignment very literally. What we're sharing with you all today is exclusively our value-added benefits. And so we don't have information here as it relates to numbers of participants who are taking advantage of our Go 365 rewards, though certainly we're happy to go back and get that detail for you all. I know some of the other MCOs have shared that data. We also don't have on any of our slides utilization of services that are already offered based on the traditional Medicaid fee schedule. The assumption is that everybody has access to those benefits and they're well utilized. So this presentation really is focused specifically on our value-added benefits. And so what you see on the screen now, these are the value-added services that we offer in 2024. So you can see how we've got these categorized according to different types of services. So health-related social needs are by far and wide the most prominent of our value-added services. So like you've seen with several of the other MCOs, we too cover the expenses associated with criminal record expungement, because we know that's very critical for people to be able to access benefits. We also have several benefits that are related to food security. So one of those is with an organization that you all heard about earlier, Mom's Meals. That is for disaster preparedness meals. So if the governor were to declare that a disaster has occurred in the state, any one of our members who are impacted by that disaster will receive meals that are sent to them. It's a box of 14 shelf-stable meals that would be accessible even if someone were without power. So that's something that's eligible for all of our members at least twice a year. We also offer GED testing support to help our members who are interested in getting their GED, which we know is really important for workforce. We have a new benefit that we started offering in 2024 for housing assistance. And so if we have a member who is in a position where they are about to be evicted, or they need some support with moving to or from public housing, or perhaps they are behind on their utilities, those members can receive up to $500 per year. Those dollars do not have to be all used at the same time, and they can help with those kinds of bills. Other meal delivery services that we do have post-discharge meals and fresh produce boxes. So if you have been in the hospital and now you're home, we will send you post-discharge meals. Again, that's through the Mom's Meal Services, as well as fresh produce boxes through an organization called Farm Box. So that's for our members that both are impacted by food insecurity, but also have a diet-related disease like diabetes or congestive heart failure or something similar. Like a lot of the other MCOs have talked about, we too make sure that our members are connected to those smartphone benefits that are available, as Stuart was helpfully described at the top of the call. And then we also have workforce development program. And so that helps our members who are seeking employment. And we know that childcare and transportation can sometimes be a barrier for that. And so we offer those as resources for that. You can see below there where we have several benefits that are explicitly for our members that we know are struggling with chronic conditions. And so to help them maintain good numbers, we've got a blood pressure kit as well as a weight scale that we can make available to help our members keep track, as well as a smartphone app called Vita, and that helps people with their diabetes self-management. Specifically for our maternity members, another program that again is through Mom's Meals, our Baby and Me meals. So if you are a member with a high-risk pregnancy, we make sure that you have access to healthy meals that are delivered to your home. We also make available to our maternity members where they can choose either a convertible car seat or a portable crib when they have their baby, and they can choose one of those for each of their children that they may have. And then we also offer doula services, as many other MCOs do as well, because we know that doulas do have a really important impact on birth outcomes, particularly for moms of color and other marginalized groups. And then the last grouping there is our wellness and education benefits. So this is specifically to help people with tobacco and vaping cessation. So anyone who's over age 12 can receive one-on-one coaching and other resources to support their tobacco cessation. Similarly, we have health coaching. So instead of going the route of Weight Watchers, we actually have our in-house weight management health coaches who can meet one-to-one with members and connect them to groups as needed to support their weight management. And we also offer sports physicals for kiddos who are needing a physical for their sports. So those are our value-added services that we offer. We also do offer a healthy rewards program. So to incentivize things like getting your annual wellness check, taking your health risk assessment, making sure that you let us know when you're pregnant so that we can help you as you're going through your pregnancy, getting your vaccines, doing your appropriate screenings and exams. You can see the different levels of dollars that are available to our members to earn on the Go365 platform. And then those dollars can be used to purchase items that are in our Go365 mall. So a lot of folks choose to purchase gift cards that they can use at places like Walmart and Amazon and buy whatever is helpful for them. Some people choose to purchase items directly out of the mall. So things like Nike gear, Fitbits. You can even donate your dollars to charity if that's something that you choose to do. As far as utilization goes, I know there were a couple of questions that have come up that I don't currently have the answer for you guys, but we have made a note to go back and ask. But what I can share with you today is what our utilization numbers looked like in 2023. And again, these are explicitly our value-added services. So I didn't make mention of anything that's on that normal Medicaid fee schedule. But of the things that we talked about before, you can see on the left, the claims. So it is possible for a member to potentially make multiple claims for a service. So as you can see with doulas, that was a service we offered starting mid-2023. So we had 30 claims, but we only had 6 members who took advantage of that service. And we're seeing much greater participation and utilization in 24. So you can see there where we've got our numbers for each of our value-added services, along with a little bit of clarification around the utilization details. And what I'll say is, you know, we definitely are on the same page as what we were discussing before about the need to further ensure that members are aware of these benefits and that they know how to take advantage of them. You know, of course, anytime our member is in contact with a Humana associate, whether that is a care manager, one of our community health workers, one of our customer care team, we always definitely make mention of these value-added services. There's mention of them when we have our quality member access committee meetings, in our handbook. Anytime our community engagement team goes out, they also talk about the services, but we know that we would like to see much higher utilization, and there's an opportunity to do that. Some other examples of ways that we're making sure our members are aware of these benefits. I mentioned our community engagement team. So in addition to these benefits, we do also offer plenty of events in the community. We host baby showers, back to school events, including for students who are part of that McKinney-Vento program, which is for members who are unhoused. We host health fairs. So there's a lot of resources that we make available to members through those kinds of events. And again, that's an opportunity for us to educate. And then we also have several pilots that are not captured in these slides, but they also give us an opportunity to test and learn different resources that we think could then allow us to determine what future value-added benefits would be. So some examples of some pilots that we have in place that are getting utilization. We do offer transportation for our members who are in need to get to their behavioral health appointments. Even though there is transportation available through the state of Kentucky, sometimes people don't take advantage of that, or there are barriers to that. And so we've developed some additional benefits to help close those gaps. Same goes for our members that are in need of transportation to maternity maternity visits. That is often a barrier for our members that have multiple children. They can't always take those kids with them, and when they use the traditional transportation service for non-emergency medical transportation. And so we're partnering with Granny's Birth Initiative. We have an initiative called Doula Dash that offers transportation to our members, and they can bring their kiddos with them, and they have childcare from that doula while that's taking place. Another pilot that we're working with, and actually our friends on the line with Aetna, we're both participating in this pilot with an organization called Samaritan. And so that's kind of similar to the program you just heard Passport talk about with Solutran. So Samaritan also offers a debit card essentially to members when they do different healthy behaviors, like make their wellness appointment happen, or when they set goals for housing and achieve those goals, they can earn dollars for their debit card and use those dollars to pay for their necessities as they work towards more stable housing. And then finally, we're working on another pilot right now with an organization called SODA. Again, very similar. It's a debit card. And we're specifically looking at our members who have high rates of emergency department utilization, because that tells us that there's probably some unmet social determinants of health needs that we need to meet, as well as our maternity members. And so our hope is that we can learn from those pilots and be able to help us determine what some additional value-added services that we could put into place could look like.
Any questions or comments? Okay, we will proceed with Anthem.
Hi, everyone.
Hello.
Just 1 second, I'm trying to get my screen to share.
Sure.
Can everyone see this?
Yes.
Okay. Well, my name's Victoria Jude. Thank you for having me. I'm the Director of Marketing for our Anthem Medicaid plan. And I'll be going over the VAB utilization for 2023.
Okay.
So as part of our population health model, we've integrated a whole health approach into our VAB offerings by aligning the VABs to both our member needs, but also building in eligibility standards to be more intentional with the benefits and promote those healthy behaviors as well. That said, I do want to begin with a deep dive into the VAB utilization report, as I do believe this whole health approach has led us to increase in utilization for 2023. When looking at our 2023 numbers, you will see that we received over 43,000 VAB requests for the year. And as we compared our 2023 utilization to the prior year, 2022, we saw a 24.4% increase in VAB utilization, with 14,368 members accessing their VABs. So when we break this down for the individual VABs utilized, you can see our top benefit utilized is the Amazon Health and Wellness Voucher, with an 11,000 individuals benefit redemptions within this benefit, followed by our transportation essentials, and that consists of $100 towards a transportation assistance, whether that's a gas card, Uber card, or bus passes to assist individuals. Now, they do have to complete the health risk assessment to be within the calendar year to be eligible, but all of our members are eligible for that one. And then our third top benefit utilized is our emotional well-being resources, which does include online communities promoting behavioral health and wellness through instruction, games, goal setting, and monitoring of our members' success through using these resources for any individuals age 13 years of age or older. And you will see that one is here at 6,411 redemptions. Now, we ended the year budgeted at $2.4 million with a membership of 165,000 members. All right. So moving on, we do strive to provide various forms of outreach and communication around our value-added benefits from, as you can see, mail, website. We have a member portal, phone, and text, because we do know there are individuals on the plan that do have limited access to internet. So we want to make sure we provide various forms of support. Now, I do want to say, when the member logs into their secure portal, this is called our benefit reward hub for value-added benefits. They will see all value-added benefits listed. Now, if they are eligible for the benefit, it will show that they're eligible and they can request the benefit. Then that will take them, once they push that request button, it'll take them through the fulfillment process. If the member is not eligible for the value-added benefit, there's going to be a button present that reads Learn More, and it will instruct them and educate the member on those eligibility standards. We also have all value-added benefits with eligibility standards in our member handbook and have them listed on our website as well for extra support. But we provide in-person and virtual education sessions directly to our members and to our partners through our new member orientations and even Anthem 101 presentations throughout the year, even given open enrollment timeframes as well. Because we want to make sure that our members have access and the support. If there's a benefit that's not working, we want to talk about that. We want to get that feedback. And then also we have our QMAC forum for feedback sessions as well, where we'll talk about any upcoming benefits that we're going to be implementing or benefits that are going to be adjusting, removing for the new year. So I do want to pause there, and I'm happy to receive any feedback from the group or answer any questions.
Any questions or comments? Can you go back to page 2, please?
Yes.
When it says total BAV requests and it's 43,708, how is that different from all the others?
So
Because
that
my
means
first reaction is, go ahead.
I can update the slide, but that's just the total of the benefit to represent all of our various benefits utilized in our system.
Okay. And then the transportation essentials are not included there?
Yes, it is. That was
it's
just all of the benefits grouped together.
Okay. It just is, it
And
looked
then it
like a
breaks-
little bit less than the 99,000.
Yeah,
Just
I can
looking
adjust
at those
that.
numbers. Okay. Okay, the next one, any other questions? All right, Edna? Your time, Edna?
Hey, it's Susan Vickers. I am going to share in case the host might be able to let me. Tristan Moyer was scheduled and is having some technical difficulties. So I'm not sure if we are able to. Oh, got it. Thank you. Awesome. Can you see my screen? We good?
Yes, we can see it.
Thank you. Thank you. Thank you. Okay. My name is Susan Vickers. I'm our lead director of quality for Aetna Better Health of Kentucky. Happy to join you all today. Tristan Moyer is our population health manager, and I gathered this and administers our value added benefit and incentive program. If her mic starts working, she will pop on and join me. I wanted to go through really quickly just a quick snapshot. We have a couple of different views that we're happy to share. This shows kind of a difference in engagement and participation in our various incentive and VAB programs from 2022 to 2023. As others have pointed out, we do kind of separate the way we administer or count and report out our gift card incentive participation versus value-added benefits. So that's something that we've really worked to try to clear up in our reporting. So you'll see that in various different slides. We are pleased to see quite an exponential growth in our unique members who are taking advantage of all VABs from 2022 to 2023. So you can see about 11,000 members participated last year. About 6,800 of those unique members received actual gift card incentives. So that monetary incentive for the various health and wellness screenings that we encourage our members to participate in. One thing we've like some of our peers have utilized a gift card vendor where members can spend a card that's reloadable for the past 2 or 3 years. And it's been very helpful to see what our members need. What are they using those gift cards? What kind of categories are they spending? And that really does inform our planning for year over year, how we administer these benefits. So you can see gift card spend on, those basic essential needs, food, milk, water, diapers, things like that. You'll see on this next slide kind of this broken down, but some of the highlights that some of our highest utilized last year were our transportation benefit. We have a huge YMCA membership that our SCI members have very much participated in. I think this has doubled even now in 2024. And then our meal delivery program also is highly utilized. Modes of communication, much like the rest of our peers, text campaigns, member engagement, our handbooks, Tip Tuesdays to our providers. We did a provider kind of blitz last year and spoke with various providers in their offices last year to help kind of understand how we can communicate our VABs better. And how providers have kind of 6 menus that they have to maneuver with these VABs for each of their members. So if you're an Aetna member, here's your menu. If you're another MCO member, here's your menu. So we've really worked with providers to figure out how to simplify that process for them. Our incentive utilization last year or year over year, as far as gift cards claimed, you can see HRAs. Definitely probably the most utilized, as was our diabetic retinal exam, HbA1c incentives. As far as value-added benefits year over year, we've seen some really good growth in this utilization year over year. I think based on kind of the feedback that we received and how we are communicating and marketing these. And then SCI specific. So we do have some SCI specific benefits that are available to that line of business as well. And just a couple of, I know we're talking about 2023, but we'll send this in. We do have some additional rewards that we've added in 2024. I'm kind of divided into women's health, behavioral health, chronic disease management, and then additional benefits that have been added that we are continuing to see an increase in utilization over last year. Any questions for Aetna?
Can you go back to the last one for a minute?
Sure.
Went a little bit fast.
Yes, this one.
Okay. Right.
And something that we've done, I think we saw several of our peers, we do a gift card for after school activities. I think it just kind of depends on how these are administered. Some are able to administer straight to a club or a organization. We were, through our vendor, able to do just a kind of a blanket after school activity that then the card can be spent on various different organizations. We're hoping that can also kind of help to increase utilization based on where someone lives or, what part of the state that they may reside, would depend on what organization might be, accessible to them. So that has been well received.
Yeah. Any questions or recommendations? As I listen to you, the value added benefits seems to be a good vehicle to focus on prevention and also to deal with disparities. And each one of you have developed different strategies that and benefits to provide to your members. And I know that when we ask you to give a presentation, was just give us a presentation about the overview of the value added benefits. And so I thank you for your diligence in preparing for this. I would like to move forward with more in-depth based on the information that you presented and ask you to for our next meeting to share what is the budget that you have, the membership, your budget, and what is the percentage of utilization, what percentage of members are utilizing the value added benefits. And as a healthcare provider, it will help me to see if people from the 7 counties that we serve are accessing those services. And it could be that we need to help you in getting the information out. We want to do everything that we can to expand access to treatment, but also to prevention and wellness strategies. And it will help. I don't know what other members of the TAC think. I think will help for us to analyze what are the utilization trends, for example, gender, language, the ethnic groups, and also the residents, the location, whether most of the members that are utilizing the benefits are from rural areas or urban areas, the location. Are we having more access in Louisville versus in Hancock or Union County? I think that will be helpful for organization to join efforts with you in addressing some of the disparities that may be there that we have not seen, and see how we can work together in that aspect. So I would like to hear from the other members that are here.
I second what Dr. Figueroa has requested. It just gives, it would give us a better perspective of the real utilization of all these added benefits. And I was trying to ask the community health workers that are dealing directly with Medicaid patients on how this is this has been accessed by patients. So I'll have a better idea for our next meeting. And I have asked this, but it's hard for me to recall. But it would give us a good guidance, and also to see how easy or how hard it is for an average person to access all these added values. And it would be a good idea to have just information. Thank you.
Okay. Thank you, Dr. Bautista. Katrina, Jordan, Dr. Burke.
Yeah, no, I'm in agreement. I think that utilization rates was one of the bigger questions we really had, was about how much they're actually being used. We've talked about the services that are offered a few times, but just trying to see, and some did show numbers more than others, but
yes,
how often things are being used in what are areas that, as you said, providers could maybe, if it's on our side, that we need to get the word out more. If it's just in general, they're not being used because they're not, the funds that are allocated for those types of value-added benefits could be allocated elsewhere.
Okay. So we're looking at the budget, the utilization in proportion to that budget. And then we want to look at utilization trends, right? Like gender, language, ethnicity, and location, rural, urban, the location, the cities, or township. Any other indicators or groups? All right. Okay.
I have a
Well,
question.
thank you so much. Go ahead.
I have a question from Danita Coulter.
Oh,
Yeah,
yes, Danita.
I just wanted
Sorry.
to make the TAC aware that the Division for Quality and Population Health has implemented that value added benefit report that the MCOs will be required to submit on a quarterly basis. So they are in the process of that. We had an initial date of July that they would be reporting, but there were some changes that we had to do to that template. So that date has been pushed back. I was looking through my emails to try to find that date and I can't come to it immediately. But that report is already it's been semi-finalized for the MCOs. And so that is something that they have in place right now. So just wanted to put that out there, just to let you know that they already have that in process. Those efforts are already in progress. So that might
Okay.
be something that that can be reported on, utilizing that UMO8 report as
Okay.
opposed to having the MCOs sort of duplicate that work. I don't know, there might be some additional feedback that others might want to have, but they already have that report that is in process. So the MCOs might want to weigh
Yeah,
in on that as well.
Thank you, Danita. I was just actually corresponding with our team as the TAC members were mentioning kind of the requests and the need for data and kind of comparing the fields on our new report with the tax request. I do think it may be beneficial for the TAC just to be able to get it from all of us in a more consistent format to see our report submissions, after they're due. And I think the next quarterly TAC would be timely as we're all completing that and submitting it.
Okay. Well, thank you for that information. I think that we're reacting based on what we have seen and what we experienced. And I don't know what are some of the indicators that you're including in that report. So I would like to add age into that mix, gender, language, ethnic group, residence, age. There might be others, but those are the ones that I could think of right now. So we will put that in the next agenda so we can follow up and do not lose the momentum in how we can join forces in getting people among the across the Commonwealth know about these services that are available, these benefits that are available. Okay. Do we have any other agenda topics on presentation for the next TAC meeting?
So
Is there
Wanda, it's
anything? Okay, go
I'm
ahead.
sorry, this is Erin with Medicaid. So just to be clear, because when we do presentation requests, I send out a follow-up email to the MCOs. But since the MCOs are already working on this information, did you want to just have an update on the report the next meeting, or do you want them to also go back and duplicate the presentation for next? I just want to make sure I have the proper requests of the MCOs if they need to be prepared to present something, that I send that request out after this meeting. Or are you wanting an update on where the status of those reports are being uploaded to the website?
When are those reports going to be completed? I mean, we do not know that. When is that report completed? When this report's going to be ready, and what will be how current are those reports?
Danita, would you be able to answer some of those? I believe she said it was in the final stages of review, but I don't know the exact timeline, so I would have to defer to her.
Yeah, I'm checking my emails right now to see that to find that first submission date. I know we had some reviews, and then we have one additional question that is still pending from our last date that was sent out, where we requested where we did give directives for a final date, but we did have an additional question from one additional MCO. And so since Angie is not available to answer that question, and I'd like to defer that question specifically to her, we'll wait until Angie comes back to answer that question. Um, I don't know if Vanessa is on or not, if she has that date readily available, but I'm trying to search emails. I can
And let
search
me ask you
emails.
this. What is are you going by fiscal year?
They
By
are
July
quarterly
1st to
report.
quarterly reports?
Yes.
Okay. All right. Okay.
But I can tell you that those categories that you're specifically asking for, we ask for the MCOs to report that in an executive summary. So if they notice any trends in regards to disparities in regions, as far as gender, race, ethnicity, language, we ask for them to include that on the executive summary trend. We ask for the overall VAB cost, so we have that separated by month. And then we ask for a utilization analysis. So we have that in categories as well. So is it through your economic stability, education access and quality, social
Okay.
and community context? Is it around your neighborhood and built environments? Or is it regarding access to healthcare and the quality of healthcare? So those are the categories that we have it in. So, and then there's those 4 different tabs that we're looking at: the VAB cost per member, utilization analysis, and the overall VAB cost is what we're looking for the MCOs to report.
Okay. So let me, so does that mean that you will be presenting next time instead of the MCOs because you're collecting that data?
I don't know if I will be reporting. I have moved to another position, so it may be
No,
myself
I'm not
reporting
putting
or
you on the
someone else.
spot. I'm just trying, we came out with some recommendations, and so it seems to be that there is a duplication of reporting. What we just want is to have that information in our next
Yes,
meeting.
so it will be someone
'Cause
from the Division of Quality, and Population Health that will present this information for this
they will
report.
present the
Yes,
information, and the MCOs will be available to answer any questions that we may
correct.
have specifically about the report. Okay,
Yes,
that sounds like a great plan, right? Okay. I just want to know who's presenting what and make sure
yes,
that we follow up. All right.
yes.
Okay. Any other recommendations for our next meeting? And I believe that we're going to have then a presentation about the waivers, like an overview of the waivers as well. Today we focus more in how to get the information out, but and there were some good recommendations for the Medicaid TAC. But however, the department chooses that they want to present the information so we could have a better idea of how to get this information and improve access. Will do. Any other recommendations?
Just going back to what Priscilla Sterling recommended, the proposition for a training session for connectors regarding the waivers, and how Dr. Schuster echoed that, for the TAC, presenting this as a recommendation for the MAC. So how do we proceed with that? Or should we wait until the next meeting after the presentation regarding the information of waivers? What are we doing?
There is a MAC meeting next week. So I will summarize some of the recommendations that we already have made and include that in that meeting. And then anything about after that presentation, if we have added ideas, we can always, does that sound like a plan? All right.
If I may step in, there's no quorum, so the the TAC today cannot make recommendations to the MAC at the next meeting. So you have to wait till you have a quorum to vote for your recommendations to present them to the MAC, unfortunately.
Okay, well, thank you, Eric, for the clarification.
You're welcome.
I
We were
will
so
send-
close today. We got to 5. So if we can get
I
to
know.
six next meeting, we'll have a quorum.
Oh, yeah. All right.
And I have
Okay.
spoken with with the Senior Deputy Commissioner Veronica Judy Cecil about engaging in the process if we have inactive members, and also most everyone's term is getting ready to expire. So how we'll go about I know this TAC is very different than the other 16 that I handle. So I'm looking for a little more guidance because I know you're all appointed by the governor's office versus an association. So I am working on my end to try to figure out what we need to do as far as on DMS's side, engaging and getting active members.
Okay. Well, thank you so much. I'm glad that Dr. Schuster was here so she can be the witness of some of the recommendations that were presented. But in any case, I will participate as a member of the community and provider and in their TAC meeting. All right. Well, thank you so much for your time and contributions today. And if there are no other items to discuss, I would like to adjourn the meeting. All right.
Thank you,
Our
Wanda.
next meeting is scheduled for, do I have the date right here? Erin, can you help me out? It's the third
I had
Wednesday.
it pulled up just a moment ago and I closed it out. October 16th.
Okay. October 16. All right.
Thank you very much.
Thank you. Thank you. Have a great week.
Thank you.
Okay, bye.